Live. Okay, hello everybody. Hello all of our guests and attendees in the audience. My name is Ayanna Rose. I'm a senior at Challenge Early College High School, and I'm one of your very wonderful hosts for this evening. I'm co-hosting with
Mia Hurts. Hi.
And for this evening, we're going to be hosting a community conversation from Shift Press. So, to get some insight into the gears behind this operation, Shift Press is a youth-led youth or publication that highlights the ways that young people have built and influenced and experienced power within the greater Houston area. This fall, they recruited a group of Houston youth to host a series of community conversations related to COVID via Zoom and other social media platforms. So the purpose of this community organization is to help us build a space by young people for young people to facilitate conversations around COVID and its effects on the greater Houston area community. And so this community conversation is really just going to be a youth-led discussion in hopes of creating a welcoming environment that connects the audience and organizers to get excited and to do groundwork with Houston organizations and other community members. And so for today's community conversation, we're going to be talking about mass conspiracies and their implications in the pandemic. So at any time, if you have any questions, do feel free to drop them in the chat. And with us today for some extra guidance and some knowledge, we have the wonderful Sujan Gogu, who I'll let introduce themselves.
Hello guys, my name's Dr. Sujan Gogu. I'm a physician in Harlingen. I'm a family medicine, sports medicine, and pain medicine physician. I work at OrthoCare, where I treat a lot of sports and orthopedic injuries. I also cover Rio Grande State Center right now, which is an area that it's a hospital that's dedicated for people that have psychological and mental health issues. So treat a lot of COVID there. In addition, at the hospital during the pandemic, I was one of the physicians that was covering the COVID units because we were pretty swamped in the Rio Grande Valley region at the time. And then I'm also a team physician for Harlingen ISD, so I cover the entire school district and the kids there. I'm also a founder of Doctors in Politics, where our goal is to elect 50 physicians in 2022 to change the conversation on health. Often right now, the whole conversation is on we need people to just get insurance, but health goes more beyond insurance. It goes into how climate change is affecting our patients, how infrastructure in terms of pipes, roads, and so forth are affecting our patients, how the FDA's deregulation of food items and so forth is affecting our patients. And so Doctors in Politics, hopefully if we can get 50 doctors to run for Congress, we can get a real conversation on patients' health. And so that's a little bit about me, and I'm excited to be here and speak to you guys more.
Yeah, so super happy to have you here, and we're gonna do this conversation is gonna be had in two sections. And to start off, we have Mia, so take it away.
Hi, my name is Mia Hurts, and I will be speaking on mass conspiracies. I'm going to set a little scene before I go into my first topic. So imagine it's 2017 and the song Mask Off by Future plays from your radio. Fast forward 3 years later, we find ourselves in a paradox living through a pandemic. So one of my personal experience of mine was I had the privilege to quit my job as soon as the pandemic began. A lot of my friends were forced to become essential workers. I remember hearing the stories of how many people did not believe in masks being useful and going against what store policy said. So-called Karens were abusing those trying to complete their task. Maybe this has to do with the fact that many states have their own regulations, or those leading the people brought forth false information without any evidence. Bringing forth the conspiracies of this being the government's way to control us, or that masks cause infections, or maybe that masks have a lot of underlying health risks, etc. When it comes to mass conspiracies, I think the best way to combat this will be through educating yourself and looking through the research given. Try finding a non-biased opinion, which in our world today can be kind of tricky. Going deeper into this, I think that masks are important because the virus is said to pass through the mouth and nose. I mean, if masks do not work, the worst that could happen would be an inconvenience by a small piece of cloth on your face. So yeah, and I have a few questions to ask one of the other speakers. What are your suggestions to combat mass conspiracies?
Is that a question for me?
Yes, sir. Sorry.
Yeah. So to fight, the conspiracy theories that are out there, I think you have to fight disinformation, especially on social media, with the right information, educating other people. Often I see on people's Facebook posts that are there, people post things that are actually, it's good information, and you get random comments there. And I think letting go of, people speaking, without truth or without fact, letting them go without telling them what's right. I think it just validates what's being said out there, and other people think, oh, maybe he's saying something true. So I think you have to fight disinformation with proper information. And I think when you come across people that are promoting disinformation, you have to let them know what the correct information is based on fact. And you fight disinformation with proper information. That's how we have to do it.
I was also wondering, why do you believe that masks are so effective?
Yeah, so you look at masks right now. You look at the countries that have actually followed, mask wearing proper masks. You look at countries like Vietnam, New Zealand, who have done that. But I think just look at the United States, for example. Let's compare San Francisco with South Dakota. Okay, San Francisco has about let's say population density wise, the city, not including the suburbs, has 883,000 people. That is about 19,000 people per square mile. South Dakota, put it this way, they have 885,000 people at 11.3 million people per square, 11.3 people, sorry, per square mile. So we all know that San Francisco is much more dense. Let's put it that way. Now let's look at the total number of cases and the number of deaths. And this was just published in the New York Times. The San Francisco has had 12,189 COVID cases. How many deaths did they have? 140. Now let's look at South Dakota. They had 40,730, almost 4 times as much cases. And deaths-wise, they've had 375 deaths. That's almost 2.5 times what San Francisco's had. Now let's look at the positivity rate, which is from the San Francisco Public Health Department. They had a 0.82% of people getting positive of 5,000 people. South Dakota has 40% of people, 2,000 people per day from Johns Hopkins University that are having positive. So what's the difference here? One county or one city has a mask mandate, and another state that is with a governor, Kristi Noem, who has allowed people not to wear masks, and they don't have a mask mandate. And so it is hurting the own people. She's hurting her own people by enacting a policy such as that. And how masks do work. There was a study that was done by Virginia Tech that shows that even wearing a simple cloth, a simple shirt, it blocks 80% of the particles one way and the other way. So you think about it, when you're a person, let's say, hopefully none of us have it, but let's say we have COVID. If I'm wearing a mask, I'm preventing the microns, which are 5 microns, from even going out into the air. Because now we know COVID is considered airborne by the CDC. So now we know that these particles that when I wear that mask, these 5 micron particles are not going to be traveling out. But let's say by chance, some of those particles do go out. If the other person around me wears a mask, now they're getting protected from those very few particles that are coming out from the mask that I'm wearing. So it helps both me and it helps both the person that I'm around with wearing a mask. So I just don't get it why people are fighting this, because there's clear evidence that it works. It shows just in the United States, if you just look at South Dakota and San Francisco. But unfortunately, it's a time we live in.
Well, the CDC, the Trump administration no longer allows the CDC to report all COVID cases. So do you believe that politics have played a major role in mass conspiracies?
Oh, 100%. I mean, I think Cornell University published in the New York Times that Trump is our number one enactor of disinformation regarding this pandemic because he has an alternative motive, which is his reelection. And I think it's hindered everyone in America. And then we've heard the Bob Woodward tapes. He very well knew what this pandemic was, how contagious it was, and for him to um, say all these conspiracy theories about this pandemic, it's just unfortunate.
Well, thank you. I will be passing it on to Ayanna.
Thank you so much. So thanks, Mia and Sunjin, for that great information. That was really insightful. So for the second section of this discussion, we're going to be focusing on kind of the greater implication of mass conspiracies, which is going to be health disparities during the pandemic. So if I could take you guys back again to the pre-pandemic time, a lot of historically disenfranchised groups have faced kind of an onslaught of health disparities, whether it be from lack of access or lack of funds or lack of employment, because the majority of Americans get their healthcare through their employee, or just not them being taken seriously in the healthcare world. So COVID-19 has only exacerbated these issues we've seen along the United States in primarily communities of colors like Hispanic and African American neighborhoods, and even very recently we've seen an uptake in Native American reservations with a high number of not only infections but deaths. And these communities, they often correlate with not only just like a lower economic status but also a low number of testing. So these historically disenfranchised groups like people of color and people with disabilities have always for a long part of our history been at the forefront of challenges, but these have only really become exemplified by the virus. So to begin, Sujan, how would you say that health disparities have affected the COVID response from your perspective as both kind of an advocate and someone within the medical field?
Yeah, so I'm in the Rio Grande Valley region, which is the entire region is very underserved. 1 in 3 people here are diabetic, which is a big risk factor for people having severe consequences to COVID. And unfortunately, areas like the Rio Grande Valley, areas that are very underserved, unfortunately, we're not getting the public health funding to do testing. And, we for a long time didn't have enough testing in those regions. And then you also look further into the fact of why has there never been any contact tracing that was ever done? Because if we had done contact tracing, and I'm surprised the White House is not even doing contact tracing in their own city. If we had done some of that, we would have controlled the pandemic much better. And so, it's unfortunate that the underserved are getting plummeted by this, and part of the reason they're getting plummeted by this is because a lot of the underserved population, they already have pre-existing conditions that are there. They have diabetes, they have morbid obesity. And then you look back and say, why do they have diabetes? Why do they have morbid obesity? Why do they have heart disease? Why do they have liver disease? Why are they having an opioid? Why is there an opioid crisis in their community? Why is there drug use in their community? And if you look back at that, a lot of it stems back into FDA regulation. A lot of it stems back into the diet that they're taking. Why are they relying on fast food more than they're relying on food that's from HEB or from that's more expensive at the end of the day? To eat healthy in America, unfortunately, it is so healthy. It's so expensive. And when you look at that and you look at what's pushed on our counters like potato chips and so forth, that's all done by the FDA and what they're regulating on our counters. And so that aspect has to be regulated to a degree so everybody can have good health at the end of the day. And so when you do develop diabetes, you do develop morbid obesity and so forth, and then now you get this COVID virus on top of it, it's just a recipe for disaster. And unfortunately, communities, minorities, underserved areas, they have a lot more comorbidities than the folk that that are more fortunate. And we have to even the level. We have to make the level field more even for this to get better. And then I'll mention one more point as well, is that you look at these vaccine trials that are now happening, with Moderna, with Pfizer, with Johnson and Johnson. They have done a very poor job recruiting minorities for this, and it absolutely is very, it's not helpful, and it's harmful, because if anyone really needs this vaccine to work, it's the minority community, it's the elderly, those are the people that need to get it because they have comorbidities, and they have reason to get the vaccine first. And so, it's unfortunate, but those are the reasons that this is going on.
No, I love your insight, and I think I really relate to that. Personally, my mom, she works in healthcare she works at a nursing home, so she works in, and it's a like a low income. Most of the patients that go there, and it's heavily minorities. And she worked in it was one of the most like infected nursing homes in the state, and a big problem was not having enough testing, not having contact tracing, and problems with PPP. So I really see that, and that's really insightful. And to kind of connect this to that kind of Mia's first section, to bring it together, mass conspiracy has played a really interesting role in all of this. So kind of as Mia mentioned, a lot of these conspiracy theories focus on this kind of whole governmental aspect of this pandemic response. There's been kind of this push to demonize the idea that the government kind of wants, this health and welfare for us all, and that they're giving us this solution. And while, the topic of this anti-mask theology has been a lot within the national discourse, primarily because of, certain top political leaders don't seem to be able to kind of distinguish the facts. It's been really well discussed, but not so often is discussed, it's the danger that it poses to our at-risk communities. So conspiracies like the anti-mask conspiracy play on people's fear that the government is trying to do them harm, or it wants to control them. And while this might not be a real thing for proponents of this school of thought, like those political leaders who are pushing and engaging this kind of theory, for historically disenfranchised groups who have, in one way or another within their group's history, been hurt or harmed by the government, that's a very real fear for them. And so that has huge negative impacts and implications for those communities or a group's likelihood to help or like willingly receive care. And even within my own personal community, like I said, my mom's a healthcare worker. So as soon as the coronavirus hit, we kind of need to take it very seriously and to mask up. And I remember going to the store and being in the line and having a member of my community kind of behind me, not talking to me directly, but kind of snidely behind, talking about how, wearing a mask and how the government's trying to enforce this, even though it's not even like a national mandate, it's just local governments doing what they can, that it's kind of this hive mind or this sheep mindset. And this is how the government is trying to kind of employ us back into slavery, which was so shocking to hear that this, positive, this one, I think, like really positive part of the pandemic that's accessible to low income communities, minorities, because it's relatively affordable, that was being perceived so negatively. So I wanted to ask, from your experience, what part has anti-mask conspiracies played in the medical field's fight against COVID and health disparities? And also, even more specifically, how has the lack of insurance from top political leaders against COVID conspiracies impacted the ability of the medical field to do what it can?
Yeah, it's been very difficult, and I feel for communities such as Wisconsin, such as El Paso, even Houston. We were dealing with it. We were dealing with it in the Rio Grande Valley. When people don't wear masks and they think it's a conspiracy theory, and there's other people such as yourself that you're mentioning, you're in the grocery line and you know the right thing to do is wear a mask, but the people around you don't. The unfortunate thing is they're putting other people at risk who really know that the mask is harming them, and so it's unfortunate, and the biggest spreader of this disinformation, unfortunately, are our top leaders. And the only thing that we can really promote is people like Dr. Fauci, Dr. Birx, people that know the facts and are presenting the facts and presenting it to our patients in a way that they can that they can process. I think we live right now in an era of so much information. You see tweets, you see Facebook posts, you see the news, and that much information is really, it's so much information for an individual to consume, and that you can only consume certain things at a time. And at times I feel like people want to feel like they know more than what's coming their way, and they come up, and this is how these conspiracy like theories come about. And so we live in an era of such high disinformation, and so you have to be really knowing your sources of where you're getting your information from. I really believe that, whether you're on the left, whether you're on the right, I think your sources of information are so important, and you have to really check your information, fact check things, and go from there.
Thank you. That was incredible. So I also want to encourage anyone in the chat to also talk about any experiences that they've had with anti-past conspiracies, and just what maybe for them what the pandemic is like and been dealing with mass conspiracies.
Well, I'll add my own input a little bit. So going back into what I said previously, a lot of my friends, they are essential workers. And I remember hearing a horror story about how my friend works at Burger King got cursed out and yelled at over telling someone like to wear a mask. And it was like a whole thing. And basically she told me that the person kept on saying, it's my right not to wear one, it's my right not to wear one. So do you feel like this has kind of like infringed upon like our rights in a way? Like wearing masks is kind of infringe on our rights a little bit?
I think it's a right of an American citizen to protect the next American citizen that's next to him. And I think people that are not wearing masks are harming their own people that are there next to them. They're hurting their own country at the end of the day. We have had about 220,000 people plus that have unfortunately died to this pandemic, and a lot of it is people not wearing masks. I think it could have prevented, multiple thousands of deaths. And if you're an American citizen, you want to, and you want to be patriotic for your country, you should wear a mask. I think it's the most patriotic thing you can do.
Also, I had one more question. So do you believe that since the government have different since the governors have different regulations and they have like their own how do I say this, their own policies they put in place regarding masks, do you think that can be kind of confusing and that has made like a lot of people not taking the pandemic as seriously as they should?
So I think there's been a lot of mixed messaging, and it's coming from the very top for us. I think if we would have had a very clear message at the very start that said everyone should wear a mask and there should be a mask mandate. I don't understand why this is a state issue. This virus is airborne. So technically, if we're allowing people to fly from New York City all the way to Montana, for example, that's a communicable disease. People can get it. And so as a country, we should have the same mask mandate, because this virus is airborne, it's contagious. So to not have that, it doesn't make any sense, but that's what we live in right now.
And I also noticed we have some messages in the chat. One message said from their experience, from what I've seen too with mass conspiracies, it's just the annoyance of being told what to do. It's so problematic because you don't see the same argument being applied to how people have to wear seatbelts in a car, even though that's also not a constitutional right, which I think is a great point to the function of masks, that they are for the safety of yourself, but to everyone. And they just help you out. Yeah, they're not really that hard.
So the one thing I want to say, fighting disinformation on, it's a good point you bring on, because if you look at the political spectrum of people on the right and people on the left, and you look at how they kind of think, the people on the right, they more or less think about civil liberties, freedom, individualistic, thinking on that realm. And I went to a lecture recently that was talking about how the right and how the left think, and how you can not fight, but how you can phrase things where the other person would be more receptive to it. People on the right tend to be like, they're more patriotic, they're really about, if you look at a lot of far right people that, are campaigning. It's literally like God, family, and country. That's kind of the stuff they post on their thing. And so how do you reach someone like that? And now you look at someone on the left, they think much differently. It's about, it's about everyone. It's about, I forgot the other two terms that they used, but how do you reach someone on the right? I'll go there. And so when I say, the way you could phrase it is, wearing a mask is the most patriotic thing you could do as an American citizen. That's something that's more appealing to someone on the right than saying you need to wear a mask. That's not going to appeal with them. Or saying you need to wear a mask because the science shows that. That's not going to appeal to someone on the right. So I think the way you phrase things to people is very important, because I think it's very different for each and every person. So if I was going to meet someone that I knew that was more on the ideological spectrum to the right, I would say wearing a mask is the most patriotic thing you can do as an American citizen. And I don't know how they argue against that.
We have another question, and it says, how do you feel about people throwing massive parties in LA?
Yeah, so, that's, at the end of the day, I don't feel good about it, because at the end of the day, a lot of these people are younger people, and a lot of them, if they do get the virus, knock on wood, they'll be asymptomatic and nothing should happen to them. But the problem is these people have family at home. They have elderly that live at home. They have people that they go to the grocery store that are there. So they're putting other people in harm's way. And why do we want to have a virus that multiplies? We're trying to keep it under control and under bay. So I don't feel happy about it. I'm glad Governor, I think Newsom has really regulated it by, I think, turning off the electricity and the water and so forth. He's gone that far. So I think it's in the best interest of the public. So yeah. I think someone was muted.
We have another message in the chat. I think it's someone's experience. So they said, as someone with a brother on the autism spectrum, I personally stumbled upon large echo chambers that distrust medical professionals and other perform ineffective or unsafe health practices. Why do you think these communities are so prominent in America? And what do you think the medical community can do to combat this?
Yeah, so this is one of the big issues. I'm with my Doctors in Politics organization that we have kind of founded, that we're really hoping to achieve. And you bring up the point of the distrust of medical professionals, and I think there's a twofold issue on that. I think we saw today Jared Kushner stating, I want to take healthcare away. I want to take healthcare away from doctors, or something along that front, where he didn't want science and doctors to really, dictate the conversation. But I also do think, just like everything that's out there in society, with cops, with firefighters, with people that do their regular job, bankers, with doctors, there are bad apples that are there. I'm not gonna say that there isn't. And so I do see that level of distrust, but I also think a level of distrust that is there in the medical community, that, especially as a physician, that I do see, and I think it's unfortunate, is a lot of times a patient comes to me and I'm to treat them, and their insurance, it doesn't cover what needs to be covered. And so then they get stuck with the bill, and at the end of the day they think, oh, it's the doctor that's charging all this money, when at the end of the day it's the insurance company that, one, is not covering what needs to be covered and says, you're on your own, patient, you don't need this coverage. And the doctor who works for that medical institution, such as HCA, such as Baylor Scott and White, who make millions of dollars and are very profitable right now in this pandemic that many people forget, they come and charge these patients astronomical numbers. And at the end of the day, the patient's like, who do I blame? Well, who did they have the most interaction with? Their doctor. At the end of the day, they didn't have any interaction with their billers. They didn't have any interaction with the insurance coder that says, oh, this doesn't need to be charged. And so a lot of that, unfortunately, there is distress there, and I don't blame them one bit. And so what can we do to combat this? I think that's the question you raise. What can we do? So I think it needs to, the conversation of health needs to not start with health insurance. When we talk about that, when I say that, I mean, we should be having more federally qualified health centers in underserved communities. We should have Medicaid expansion so everyone can get healthcare in America. We should have more FDA regulation on our food items that are there on the counter. We should have vaccines covered, all vaccines be covered by insurance. And not only that, have HPV covered on top of it, which is not one of the vaccines that is covered. We should have preventative care visits that are covered by insurance without people being scared. So there's so many things that, just are not happening, and patients are not getting these preventative care measures and so forth. And so it's unfortunate. And I think the conversation that we have right now for healthcare, it needs to just not be over insurance. It needs to be on health.
And we have another question. Do you feel the anti-vax movement will cause problems after the pandemic if a vaccine is eventually made?
Yeah, so Dr. Fauci made a comment on this. He's like, my biggest fear after a vaccine is created is that nobody takes it. 40 to 50% of people take it. And at the end of the day, to get this pandemic under control, you need about 85%, I believe, to take it. For us to get this, for us as a community to get immunity. So I think they're going to be the misinformation we're going to see from that side is going to be really, really upsetting and really harmful. And so that's the misinformation we need to fight. And Twitter's playing a role in that right now, doing a great job. They just started recently fighting misinformation. Hopefully Facebook plays a role. I think our social media platforms play a role, but I also think citizens have a role. If you come across, your grandparent or your friends or something not speaking in fact, I think you have to correct them. Letting it go, saying, oh, it's going to affect my friendship, or this conversation is going to be a difficult conversation and I don't really want to deal with conflict. I think it's just that person that's speaking that disinformation is going to speak that to other people, and it's just going to spread like wildfire, and that's how it spreads. And so we have to fight disinformation with fact. And that's what I'll say.
So I'm trying to see how to say this. So basically, like, let's say a vaccine comes out really quick. Like, do you think that we should take it? Because I kind of feel like I don't trust anything that Trump does, because over time I've seen like how he's lied and conveyed himself in like a certain way. So do you believe like that ideology is kind of like burdening like the vaccine coming out and all that anyways, or what?
Yeah, so I mean, we all watched the debate. We saw the vice presidential debate and what Kamala Harris said. If the vaccine comes under the Trump administration, I don't trust it. I don't want to take it. And I think that goes a little bit. I think it goes a little bit too far, to be quite honest with you, because I think right now we have a whole FDA process: phase 1, phase 2, phase 3 trials. Right now, 3 companies are in their phase 3 trials. But I think the aspect that I'm very optimistic about is that we have an independent commission that's going to review the vaccine data. Who's on that independent commission is Dr. Fauci. And so I trust Dr. Fauci. If he at the end of the day says this vaccine is going to be safe, I'm going to believe it's safe. Not only that, I think there's enough data on phase 3 trials. If you think about how many people are on these phase 3 trials, some of them have 20 to 30,000 people that are getting this vaccine on phase 3 trials. And then you're comparing that to a placebo. And so I've heard my own friends say, hey, I'm just going to wait it out a couple months, see how everyone's doing when they get this vaccine, and go from there. And I think, well, it's really not. You're not. It's already been studied by 20 to 30,000 people on phase 3 trials. So waiting to see how this data goes, I don't think it's going to help. So if Dr. Fauci and that independent commission that comes out and says this vaccine is safe, I think it is safe.
I have one small question about that. So basically, you know how like the Trump administration was able to control the CDC in a sense. Do you think they'll be able to control this as well? Like, does this play a factor in it?
Yeah, so you bring up a great question. And to be honest, I think by then, I'm optimistic. This vaccine is not going to be, I mean, I know Trump says I'm going to get a vaccine before the election. I'm going to get a vaccine before my presidential my presidency and is over or renews or whatever happens. I think we're going to get a vaccine later down the line in March, and I'm optimistic by then that things change politically. But if they don't, I still expect Dr. Fauci, Dr. Birx to have those type of data who worked for both Republican and Democratic commissions. And I think that data will be published out there for people to see. I think the last thing people want is America to be a laughingstock if this vaccine actually does more harm than any good. Because at the end of the day, everyone is watching us. Whenever this vaccine comes out, it's going to come affect American citizens, but this patent, I can assure you, will go to other countries as well. And the last thing you want is America to look like a laughingstock on the global scale, on the global spectrum. So I'm optimistic that this vaccine that comes out is going to help U.S. citizens. I think the question to raise, and I think it's a fair question, is how good is this vaccine going to be? That is the question that I think is the $1 million question. Is this vaccine going to help people for a lifetime? Is this going to help people for a year? Is this going to help people for 6 months? That's the true question that I want to know. And I don't think that's a reflection of, oh, they told us that I don't think it's a reflection of this vaccine being sold to the American people in the wrong way, because you're trying to speed. Vaccines normally take 5 years to 10 years sometimes to be produced. And we're trying to do this in a span of 6, 7, 8 months, a year is what we're trying to do it. And so when you're talking about data for 5 years, we're just not going to have that in a year. And so I think as people, I think when this comes out and if we find out, for example, oh, this only helped people for a year, I don't think that should be looked upon as being a bad thing. So I think it's important to have realistic expectations on this vaccine.
And I guess I think on that point, I would just like to say that, like, it's not only is it important to, wear your mask to protect yourself, your family, and your community, but it's also very important to vote. So if you are 18 and older, it's super important that you have your voice heard so that you can make change, so that, these changes that we're talking about are feasible for us. And is there anything else that you'd like to add, Sujan, for the audience to take away today?
No, I think as I said, this pandemic is tough. It's not tough. It's tough not only on us with this virus, but I think it's very tough on us socially. We're away from our friends. We can't do the things that we want to do. We can't play sports, and so we just got to hang in there. If you need help, in terms of as a family, or you need help psychologically, you need help from that standpoint, you should try to seek the help that you need. But I think this pandemic has caused a lot more problems than just this virus. People economically are struggling, people psychologically are struggling, people not getting their preventative care visits, they're struggling from that standpoint. And so it's important, to get help when you need help. But the best thing you can do right now is vote. If you want to see change, if you want to see more governmental funding for citizens, it's unfortunate we haven't even had a stimulus package for the millions of Americans that are out there that could help with contact tracing, testing with this pandemic, economically can help them. It's unfortunate that it hasn't been done. So the only thing we can do is vote. And so I encourage everyone out here to vote, and hopefully we get some change. I think someone's muted.
Well, then thank you to everyone who tuned in today's community conversation. To hear more conversations like this, follow Shift Press at Shift Press virtually on all social media platforms. And until next week, conversations at the same time. We'll see you later.
All right, thank you guys. You guys take care. Be safe out there.